Assalamualaikum dear doctors. In this video I am discussing about urinary tract infections. So treat the symptomatic urinary tract infection in infants promptly to reduce the risk of renal scarring. Now symptoms and sign of urinary tract infections. Infant age less than 3 months. The most common features are fever, vomiting, lethargy and irritability. Intermediate features are poor feeding and failure to thrive, and least common are abdominal pain, jaundice, hematuria and offensive urine. Infant age more than or equal 3 months and the children, there is, we can divide pre-verbal and verbal. Most common are fever and frequency dysuria in verbal cases. Intermediate features of more than 3 month old are abdominal pain, loin tenderness, vomiting, poor feeding, dysfunctional voiding, change of continency, abdominal pain and loin tenderness. Least common presentations of UTI more than 3 months of age is lethargy, irritability, hematuria, offensive urine, failure to thrive, fever, malaise, vomiting, hematuria, offensive urine, and cloud urine. Now, according to NICE guideline, the management of UTI is that if age less than 3 months, cystitis or lower UTI, as per sepsis guideline for antibiotic choose and durations, both cystitis and pyelonephritis. Remember, less than 3 months we give the IV antibiotic, culture sensitivity, lumbar puncture if needed. More than 3 months or equal 3 months old, for cystitis, we give the treatment nitrofurantoin tablets only or coamoxiclav or cefalexin for 3 days. More than 3 months old, acute pyelonephritis or upper UTI, we give the treatment. If outpatient, then coamoxiclav. If penicillin allergy, we give the ciprofloxacin. If septic, we give the gentamicin state dose, then ceftriaxone, then coamoxiclav if no organism identified. Some question come on AKP exam, EMQ question. First question is that 3 weeks offensive urine WBC in urine is sample more than 100 in 10-6. So what is the treatment? Look the age, that is 3 weeks. We know that below 3 months as per sepsis guideline we give the IV antibiotic. Sensitivity we do, and also lumbar puncture if needed. So here 3 weeks UTI symptoms we give the treatment IV cefotaxime and amoxicillin. Next is that 6 weeks apnea, persistent cough, WBC 17 and lymphocyte is 10. Normal lymphocyte count is 4 to 10. Here all the features: persistent cough, lymphocytosis, apnea. Supporting the diagnosis is pertussis, and look the below box. The pertussis according to NICE guideline treatment is macrolide, that is we know macrolide are azithromycin, erythromycin or clarithromycin, 7 days duration. So second question the answer is oral clarithromycin. And the last one is that 8 years. Left loin pain, dysuria, can take orally, clean catch is WC more than 90 in 10-6. So all features supporting diagnosis UTI, and 8 years age we give the treatment. The third one oral cefalexin. For more than 3 months we give the treatment nitrofurantoin or coamoxiclav or cefalexin. Now there is another EMQ questions, that is neonate 3-week UTI symptoms. We know 3 weeks. So we give the IV cefotaxime. Next one cough and lymphocytosis, that is pertussis, we give macrolide clarithromycin treatment. And the last one fever and loin pain, we give the coamoxiclav. This is all about urinary tract infection. Please do subscribe and share MRCPCH with Dr. Emma Choudhury. Thank you.